I'm Courtney, and today we are going to do a dressing change on a midline. So I'm going to go ahead and introduce myself to the patient. I'm going to identify by at least two identifiers to ensure that I have the correct patient to do the correct procedure. So once I have that verification, I'm going to go ahead and explain the procedure to the patient that we're just going to change this dressing and it should not take very long. So with my clean gloves on, I'm going to go ahead and stabilize this. I'm going to go ahead and start removing this current tape.
I'm sorry, what? Do you want us to try to save?
So you'll start from the outside and work your way around the edges of it towards the insertion site.
Is that? Sure. Yeah, just leave them in the drape and fold it up. Put it back in the drape. Got what? I'll get it out again tomorrow.
There's 3 people have to
Gloves do not make it easy.
So that's what I said, it's not, you guys are freaking out, but I mean, what other tests can you fail and retake and still get a 95%?
So I'll make sure to keep this held in place to stabilize it. Okay, so once I get that off, I now need to clean the insertion site before we put the new dressing on. So I'm going to go ahead and take off my clean gloves. I'm going to now don my sterile gloves.
I said the same thing I told you guys. I said, look, you take a test and take that one.
Make sure you don't put your sterile gloves on over your sterile field because you could end up contaminating your sterile field and it ends up ruining everything in the kit and then you have to start over. So in this case, I'm going to go ahead and open up my alcohol swab. Some places you'll use like a chlorhexidine or something like that. In this situation, we are just going to use the alcohol swab. So I'm going to take one, I'm going to go ahead and I'm going to contaminate my non-dominant hand, so it'll be my left. So I'm going to go ahead and hold this in place. I'm going to make sure that I prop this up. I'm going to go ahead and start towards the center of it. And as I work my way around the line, the entry, I'm going to go ahead and turn the cotton swab to make sure that I get it clean. So now I'm going to go ahead and do it again. I'm going to go a little further out than previously. And if I need more than just the 3 that I'm using, I'll make sure to have more than just the 3 cotton swabs on hand. My last couple of ones, I am going to want to clean the tubing. So I will go up on one side, and as I do that, I will turn just a wee bit on the cotton swab to make sure that the clean is still on the item itself. Once that is done, I'm going to go ahead and let that dry. While it's drying, I'm going to ensure that this line is correctly positioned and that not at any time has this tubing displaced out of the cavity at all. If for any reason, if this tubing did come out of the cavity, to be alarming, I would go ahead and I would tape the tubing in place where it's at, and I would contact the charge nurse to get this reassessed by a nurse that is specialized in the placement of these tubings, or contact the provider to see where we need to go from here. So in this case, the patient has not had any issues. The tubing hasn't come out or anything. It hasn't dislodged or come out far enough that I need to be concerned. So in some cases, some of these kits will have a little gauze. Sometimes you'll use these, sometimes you won't. If you do, you can go ahead and put this in place around the insertion site, just like that. So in this case, because I'm going to be using a taping that is pretty small, I'm not going to keep that there. So once that is dry, I'm going to go ahead and use my Tigederm. So, like I said, this Tigederm is pretty small, so I wasn't going to keep the gauze in place. So I'm going to go ahead and get this prepped to be placed on. So I want to make sure that these are all laying in the proper place before I place this Tigederm on. You want to make sure that the insertion site is in the clear window because we want to be able to keep an eye on that.
I'm sure Sandy would appreciate receiving it too, but
Okay, so once you get the main part of it on, you can go ahead and start pulling the sides of it off. I pull it a little at a time, so that way then I'm able to fold it down as I go. So that way I don't run the risk of it coming up or anything like that.
Jesse, I know Jessica Bennett, so she was fine, but the rest of them.
Alright.
So I forwarded that to Sandy so she would know.
So in this case, I can now make sure that this taping is in place, which it is. And then what I will do is I can take some saline solution or heparin. Depends on if the order calls for the heparin or not. Since the heparin is a drug, you do have to have an order for that. But for saline, we're going to go ahead and attach the saline to each one of these ports to ensure that they're still flowing and that they're still open. So in this case, I would go ahead, I'll clean my first one. So you do not aspirate when you are doing this. So I'm going to go ahead and pour a little bit of saline in to make sure that it's open. You want to go kind of quick since it's in a venous line. So because if there is any resistance or any kind of a clog or anything like that, you'll want to be able to push it through. However, if it's too much of a push, then you're not going to force it through. You're going to stop what you're doing. Go ahead and unattach your heparin or your saline, and then you will go ahead and contact the provider or your charge nurse to let them know that there's something wrong. So you make sure that you get a new alcohol swab for each tubing that you have. Some of these PICC lines, or some of these lines come with 2, some come with 3.
Yeah, and that person, once they call your name, that person that you
So we'll do it for each one of these. Make sure it's unlocked.
Well, we should just be kind of walking that way. I don't know, I think for the rehearsal last time, I just sure. Because I had to drive for 45 minutes of rehearsal, and I looked at them and I said, tomorrow's my birthday and I'm going skiing and I will not be there for rehearsal. And so I just
Now, if you are using heparin to flush this out, you will make sure to run alcohol on the end of these ports afterwards as well. So now that that's done, I can go ahead and deglove. Now some of these kits do come with a sticker so you can date and time it to know, so that way the following nurse will know when the last time it had been changed, to determine when it needs to be changed again. In this case, I can also just go ahead and write on the Tigederm. So I'm going to go ahead and do that.
That would be hilarious.
So you're going to date it, time it, and initial. And then when you're done, you can also ask the patient how they're doing, assess the patient, make sure they're not in any pain or had any discomfort or anything like that. And that's it.